Social Services for National Public Health Week. And I see we have a good cross-section of the different, there's just so many divisions in public health, from environmental health to, of course, SNAP, benefits, COVID, right? I mean, just tons and tons and tons. And there was a, what was it, Bria, virtual, was that a national proc signing yesterday or Monday?
No, it was the governor holding a proc signing, but it's National Public Health Week, I believe.
Yes, it is. It's your week, ladies and Jerome. So we have here Liz Calvo, who works in Director Art St. Augustine's office, and she is joined by May Fay, right?
May Fay?
May Fay, yes, out of the foster care division. We have Jerome Garcia, who is a health inspector with Division of Environmental Health. I wonder if he's the one that took the video of that rat. And, of course, the Public Information Officer for Public Health, Janella Carrera. Good morning, everyone.
Good morning. Good morning, Chris. Good morning, Bree. Good morning, Jason.
Happy National Public Health Week.
Right on. Good morning, Jerome.
Good morning. Thanks for having us.
Of course. And let's just go ahead and start with, I wanted to start what I felt is the most important thing, which was, May, you have some info on foster care, right? Are we still in desperate need of foster parents, May?
Oh, we are in desperate need of foster care. I am the supervisor for the home evaluation placement section. And currently, in my last report last Friday, the statistics is we have 406 foster children right now. And it just seems to be increasing. We're working hard and we're protecting these children. And I'm seeking a shout out to everyone who would like to be a foster parent, to please come and be one. You just have to have a loving home, and we're here to support our foster parents.
You said 406?
We only have 40 licensed foster homes right now.
Wow. And so where are these kids if they're not in foster care?
Okay, so what happens is when we take children under our protective custody, we always try to look for relative placement first. So right now we have 202 of our foster children in relative placement. We also utilize our group homes, alley shelter, sanctuary. They are a great support for us. And if we're not able to, we look for any individuals who would like to take these children in, and we do a background check, even though they're not licensed, to ensure that their home is safe for our children to be placed with them.
How do children end up being in this situation? What are the circumstances that lead them to having to go into foster care or having to be placed with a relative?
Well, the reason why children are placed in foster care is because we remove them because there's harm in their home due to abuse and neglect, and they're in danger. And we do the full assessment, and when we feel that a child needs to be removed, unfortunately, which we do not like doing, we do need to place them in a safe home. And the goal is always to reunify these children with their families. That's the ultimate goal. But before we could do that, we need to place them in a safe place.
So you said in your open 406 foster children, and it's increasing every day, right?
That's, sure is.
For these 40 foster parents, these licensed foster parents, how many, I guess, foster children do they have on average amongst them?
Okay, so each foster family, they are licensed to have as much as 6 children in their home. They can be licensed for 6 children as long as they don't displace any children in their home. So for example here, if Lizzie decides to be a foster mother, she has 2 children. I could only license her for 4 more children to have the capacity of 6 children in her home without displacing her children. And they have to ensure that these children have their own beds and have to be approved by our licensed worker, licensed foster social worker.
Are most of these foster parents then taking it up to the limit that they're allowed to?
Oh, they are taking not only, even though they are licensed for 6, and if they still have room in their home, we would ask if they could take extra. We are allowing them to take more than what they're licensed for because we need to place them.
We had a comment here. Are siblings put together in the same households?
We do our very best to put them all together. Right now, the need for foster homes are, we have problems finding homes for teenagers, for sibling groups. We're finding that we're having a large numbers of siblings, up to 6 to 8 siblings. I'm surprised in the last couple of years, there's a lot of sibling groups. We need homes for children with disability. We also need homes for children with medical conditions. Those are the homes that we are having difficulty finding right now.
Would it help at all if that Regalu Foundation, that foster home, if it were open?
It is, and I do know that they're doing their very best to try to open that home. Unfortunately, that's not in my capacity. My goal is to look for home, to encourage people to become foster parents, and to have my office give whatever support they can in order to become a licensed foster parent.
May, you said that it's very difficult to find foster parents for the children living with medical conditions. How many children
Yes.
are we talking about here?
Well, right now, I do know of one child who needs medical help right now, and 1-to-1. She is placed in a home right now, but we are looking for someone who can give more 1-to-1 care for this child. And I know there's about maybe between 5 and 10 foster children with medical conditions.
And then there's a compensation involved, right, for foster parents? Can we talk a little bit about that?
I'm sorry, compensation.
Is there
Yes.
compensation? Yeah.
Yes. So if you're a licensed foster parent, you do get compensated when you are licensed, depending on the age of the children. So our foster family social worker does an extensive background check on individuals who apply to become foster parents. Not only do we do a home assessment or a social study on the family, we also look into their financial background because we want to ensure that any individuals who apply to become foster parents, that it's not there for, they're not in there for financial gain. They're there to give a loving home to our children who really need that right now.
Tough. What's up, Jerome?
Good morning. How are you guys?
Tough act to follow there.
I know.
So you're a health inspector. You go out. Can you just give us like your average day with the Division of Environmental Health?
So actually, as an EPH03, I primarily oversee and manage the mosquito surveillance and control program. So that's my primary duties, but I will go out on inspections if there's a need. Right now, of course, as you know, environmental health, our staff is quite short, and we're responsible for making sure health regulated establishments on island are all in compliance with the sanitary regulations as far as COVID compliance as well. But I would say for the daily routine for an environmental health inspector, we come in the office in the morning. Again, because we're so short staffed, we prioritize complaints that come into our office. So if there's a complaint about a restaurant or another establishment, those are the things that we tackle first. We would do our research before we go in, go out to do the inspection. And from there, we try to hit probably two to three inspections a day, if possible. But some places, their establishments are so large or the inspection is complex that we can't really hit as much, especially with the limited staff that we have. But I would say for inspection wise, we would prioritize complaints first.
Right. So, were you the one that videoed the rat? Where's that, Bree? Remember that rat that
Which one?
Malou was talking about?
Me video?
No,
Oh,
no.
you're talking about Jerome. Yeah.
We had Malou on it. It was like a few days ago, and she was talking about they did this inspection. I want to say it was a reinspection of American Bakery, and that there was one of the inspectors had caught a rat on video, that's
Oh, I see.
an accomplishment. That wasn't you?
No, that wasn't me. That was one of our our other staff.
Well,
But yeah,
us.
so
Go ahead.
But did you
Good.
see the video?
Did you see the video?
I definitely did. Yes.
Man, Janella, what's
So-
up? I thought we were cool. You didn't send that?
Yeah. So of course, when we do our inspections, we do take photographs of violations, so that way, we can document, and then we can work with the establishments to, correct the issues at their establishment. So
Let me ask this without getting specific or naming whatever business it was. What is like the absolute worst horror story you can tell us as someone who goes out and inspects restaurants and businesses? No names, because I want you to get juicy.
of course, no names, but there are items that call for immediate closure. So things like infestation of cockroaches or pests or rats, I would say those are, the most critical violations, which would call for closure. But of course, not naming any places. It is quite shocking to see those things at a restaurant. So I strongly recommend, places do continue to keep up with their sanitation to make sure their food temperatures are good. Yeah.
Do you still eat out as a health inspector? Going to these places, seeing these violations? You're probably like the best guy
Where
to eat
would
out
you
with.
recommend?
Yeah. You guys need to come out with a list of like Jerome's picks.
I mean, I do eat out occasionally, but I'm stuck in the office all day, so I'm quite forced to just make my own lunch and eat it here to get work done. Yeah.
Sounds like he doesn't really recommend eating out. He's like, yeah, you guys eat out. I'm eating it. Is it, Jerome, we had a couple times back, Janella, we had Malou on, and she was talking about doing COVID inspections and just inspections at like bars, right? And so I guess she was saying that there were a couple female inspectors who didn't feel really safe going out at night and inspecting the bars. I think she had even said something about there was like one of the bar owners that had really become like aggressive to this inspector. Is that something that you guys deal with? I mean, not just with the female inspectors, but I'm sure even you, if you shut down a business or, I mean, I'm pretty sure the owners or even the employees aren't really ever happy about it.
I mean, it is a tough balance because as much as, we're trying to enforce and make sure everyone's in compliance, we do want to still collaborate, work, and, educate the people about, especially, COVID violations. But that when we do our night inspections, we usually pair up with female and a male. But some circumstances, it just so happened that the two ladies had to go out on their own that night. But it's usually paired up with a male and female, so that way, we're both safe. We're both looking out for each other. Wow. And like I said, it's inevitable. Bar owners or people in charge of their establishment, of course, they will sort of feel a bit aggressive when we're coming in to tell them, what violations are existing in their establishment. But again, it's all for the safety of the people. Yeah. So to ensure that you guys can continue to conduct your business while keeping everyone safe.
Let me ask you this, as someone who does eat out, and you being someone who does inspections, just as when you get into a restaurant, what are some like places or telltale signs that people who are dining out can kind of look for to make maybe their own determination about, is this place clean, or is it, is there an issue with rats or roaches? Are there any hacks that you have as an inspector to share with the public?
Like life hacks or inspection hacks? Yeah. Well, I mean, the only way you can probably tell is, of course, is just to use your vision, right? So if you go into a place and, that's like the first layer. If the surfaces are dirty, if there's, debris or dried food particles on the table or on the counters, that's usually the first telltale sign, because you would always want to have your surfaces clean, your equipment clean, your utensils clean. But as far as food safety, it's a bit tougher because we primarily focus on things like food temperature. So you won't necessarily tell if the food's been cooked properly or if it's been kept chilled properly without using a thermometer. But I don't think you guys would bring a thermometer to every restaurant you go to, because those are actually the major factors that could make you sick. Wow. As far as looking out for infestation clues, if you guys are familiar with what a cockroach egg looks like, they're the brown Uthicas, and if you can spot them around, that's probably a sign that they're out there in the day. As far as rodent droppings, but again, it's a very visual thing to do and to.
Usually that works. It was just getting juicy there, Janella.
Oh man, he froze.
Yeah. Let's go with Liz. Now, Liz, you work in the director's office, right? And you're a program coordinator?
No.
Okay.
I work under the Division of Public Health, under the Bureau of Family Health and Nursing Services.
I'm so sorry. So sorry.
No worries.
Yeah.
I mean, we're all under the directors.
I got you, of course. So tell us a little bit about what you do.
So I am a project director for, it's actually a new grant. Guam has received $3.7 million, and it's called a Preschool Development Grant, Birth to 5. It has nothing to do with the preschool classroom, as one would think, but we support the early childhood comprehensive system on Guam. So all the early childhood programs from the small nannies all the way up until 5 years old.
So are you saying that you guys do like the hearing and all those different types of tests that the younger kids go through?
So we do support that. That program is called the Guam Early Hearing Detection and Intervention Program.
Okay.
And that's under UOG Cedars and the Department of Education Division of Special Education. And so, yes, they would fall within Guam's early childhood system. So it's the system of services and supports for young children, birth actually all the way up to 8 years old. So early childhood has been defined in recent years, over the past 10 years, as birth to 8 years old. And so our grant, though, specifically is for birth through 5.
Interesting. So what would you say to parents out there of young kids? How can they avail of your services, and what are some of the crucial things that you guys do?
So one of the things that we are hoping to kind of get up and running is called our Nanny 311 line. And so we're going to have an extension in the COVID 311 line where parents can access information and do just exactly what you're saying. One of the things we want to promote, if you can visit, families can visit the Guam Early Learning Council's Facebook page. And there's a wealth of information on there about developmental monitoring. And so we want families and parents to understand what child development looks like. And so if they see that their child is not developing on track, then reach out to your pediatricians, reach out to your family practitioners and say, hey, I have this concern. My child is 2 years old and he only says 5 words. And, my older child, when he was 1, he was actually saying, the same amount of words. And so we want them to know where to go to access those services. And there's CDC actually has an app. It's called the CDC Milestones Tracker. And so if you just Google it, you can download the app. And there's a whole national campaign called Learn the Signs, Act Early. And so that's, it gives the information in the hands of parents right on their phones. Majority of parents have smartphones now. And so they're on their apps and it provides a wealth of information. And it doesn't diagnose your child as having a disability or developmental delay, but it really gives the information in the hands of the parents to know what are some of those red flags to look for.
Right, and that's so crucial. I mean, as a father of 5 kids, I mean, you do, of course, look for those developmental milestones, and it's so easy to compare child to child, and they all kind of develop, differently. But What's it like
Correct.
when you're working with these parents and you know they have an idea that there may be an issue with their child with a disability, and when you conduct whatever testing you do, and you have to break it to the parents. What's that like for you
So
guys?
most of the early childhood programs, we use a developmental screening tool called the Ages and Stages Questionnaire. And we also have a social and emotional tool that we use. And so it's a parent questionnaire. The parent actually is, because parents are the ones who know their children the best.
Right.
And so it has questions on the different developmental areas, and they answer it. And we just let them know, hey, there's some concerns here. And we have within our early childhood system, we have a universal referral form, and it has all the different early childhood agencies who provide the services and supports. And so if we see that a child has a developmental concern, then we refer them to the appropriate agency, and that agency will then complete a full-on assessment using whatever tools that they have. And then they're the ones who inform the parents that, you know, these are the kinds of supports that we need. We can refer you for speech therapy, let's say, if a child has a speech delay. I have a son with autism, and I just have to say that, you know, knowing where to go to reach out to for services is very, very crucial. And so, and one of the things that we promote with parents is that early detection is best, because the earlier we can detect a developmental delay or a disability, the sooner the family can reach out and get the services that they need, and that child can get the intervention that they need. And that prevents, I don't want to say prevents, but it sets the child up
Right.
for lifelong success, rather than waiting for the child to enter kindergarten or first grade and for, you know, to see some of those delays happening. And then there was such a crucial time for interventions that was missed. So again, early detection is best so that we can get the interventions as early as possible.
Thank you so much. That's sounds like very important work that you guys do. I want to go back to Jerome because we were kind of cut off there. You froze up a little bit, Jerome. I want to thank you for the life hacks on eating out. We did have a comment here. Environmental inspectors, what number do we call if we're dining out like after 5 p.m. and maybe they see something that they want to report? Is there like a hotline or something, Jerome?
So our office hours are 8 to 5, but sometimes, you know, our inspectors are out in the field, but there's no one at the office. If you do want to submit a complaint, well, our morning office hours are 300-9572. We also have on our website at the public health site under our division, there's actually a form where you can fill out your complaint and then print it out and then email it to us. Our email is also dphss-deh at guam.gov. So if you'd like to send your complaints there as well, I think that'd be much more convenient since it pings all our emails.
Right. Okay.
So.
Janelle, I wanted to go over to you because I know that last year you had gone from the governor's office over to public health, and you know, and had it not been a COVID, a pandemic, some might say like, oh, that was, you know, oh, she's going to go over to public health. That's going to be way less busy, you know, maybe a little bit easier, a little less pressure, but that's not what happened. You kind of, yeah. I mean, I don't know if it was a little bit of backfire. Like maybe you thought, oh, public health, that, you know, that's not bad. Let me put it in an app over there. But I think you settled in nicely. But what's it been like to kind of go over to an agency like public health in the midst of a pandemic, and to now be at this position where we're just rolling down this path to half with the vaccinations and really kind of crawling out of this pandemic?
You know, you're right. I thought that going to a GovGuam agency might perhaps not necessarily reduce the workload. I didn't know what I was thinking. I mean, it is a COVID pandemic. Public health is central to the pandemic. But my workload actually nearly doubled, actually probably doubled or tripled. But, you know, I was grateful for it. And it's one of those agencies where the type of work you do is very rewarding. And the people that you work with they're just phenomenal. and everyone. They're very passionate. Public health is a calling. But, going into this with the vaccinations, the testing, and everything that we do here, whether you're putting in overtime, they tell you this is what we're doing day in, day out. Even if it's the night before, a few hours before, nobody ever complains. We just go in and we do it. So I'm actually grateful for what I do and the people that I work with and being able to do this for the community. And now that we're on this path to half and seeing, the light at the end of the tunnel, it's been an amazing adventure, and I'm really glad to be here, and I hope I can stay. So, that's in a nutshell what it's been like, the experience here at Public Health.
Right on.
Like Lizzie Calvo, Mayfaye, Jerome, the kind of work that they do, and everybody else here at Public Health. We've been recognized for National Public Health Week this week. Liz Calvo's been amazing, just putting everything together. But I mean, every single day, I think public health should be recognized for the kind of work that we've been doing. The lives that we've been saving. And I say this all the time, every time I get asked, what's it been like at public health, coming from the governor's office and then coming from the private sector, from the media. But really, from the bottom of my heart, this job is probably, I mean, I don't mean to put other jobs down, but it's probably been, one of the best jobs I've ever had. So.
Well, I hope the director is listening for that. But I want to thank you guys for coming on. And Janella, I'm going to touch base with Director Art, and we really like to get some of these different programs, like foster care, because you guys have a ton of programs, and maybe get them out more on the show to kind of get the word out or promote whatever they need. So thank you guys for coming on. It's been a blast and happy.
Can I just make a quick plug?
Yes, you can.
Yeah. So if you want more information about what we've been doing for Public Health Awareness Week, please visit our department's Facebook page. We've been posting since Monday morning. The proclamation is there. And each day of the week, this week, we've been featuring different divisions. Monday was Jerome's division, and you got to check out his Miss Gita Spirit video. We've got her dancing up there. I was hoping Mosquito was going to make an appearance. There we go.
Well, Jason's, there you go. Wow.
Yeah. Yesterday was the Division of Public Health, and today we have the Division of Public Welfare. And if you want more information on foster care or becoming a foster family, there is a presentation at 1:30 by Gracie Washida, Social Worker 3. The schedule is on our Facebook page. You can join us in our Zoom room, or you can watch via our department's Facebook page. So tomorrow we'll be featuring Division of Senior Citizens, and Friday is our Division of General Administration, where Janella and the director falls under. And this week was really just to celebrate all the great work that our public health workers have been doing. We have slideshows. There's employees who have been here for, I think the most was 43 years. And so each day we feature that division and the employees. We call it honoring our employees with 25 plus years of service. And so we encourage you to go and see, you may not know that your aunt worked for public health for 30 some years. And I just want to make a shout out to my aunts, Patty Bileto Cruz and Francis Bileto Santos, for 30 plus years of service. Thank you both so much. And to all the great public health workers who've been here.
Thank you guys.
Also,
Thank you.
I don't know if we're going to be posting it. Lizzie has the videos, but we have like some of our agencies who did the electric slide. And we have a video of Chima and Bakwim dancing to his nice little African dance. So we'll probably be posting. You want to see Chima dancing?
Yeah, send that and the rat video.
Yes. Visit our Facebook page. And I don't know if Chris, was L'Oreal able to send you the little virtual open house that the director did? I did. And then, our theme this year is building bridges to better health. And our director, in his remarks on Monday during the proclamation signing, he said it's based on the concept that we may be physically distant from each other, But now more than ever, it's important to come together. And of course, with COVID happening, that was one of the best things that could have happened, I think, because not one of the best things that could have happened, but in terms of bringing people together virtually. And so again, building bridges to better help, and our social media and virtual platforms make it easier, so much easier for us to connect these days.
Thank you.
Again, visit our Facebook page, social media.
Right on. Viva Public Health. Viva! Right on. There you go.
Thank
Jerome.
you.
Viva.
Hey, Jerome, send Janella that rat video, man. I want to get that.
Yeah, I got you.
Okay, gotcha. Thanks. Good stuff. 9:23. It's National Public Health Week. They had some interesting divisions there. Senior citizens. I want to try and get them